Hi, I'm Dr. Craig Escude, President of IntellectAbility. Welcome to Medical Monday. Our topic today is another one of the fatal 5+ conditions that are preventable causes of illness and death in people with disabilities. Today we're going to talk about aspiration. So this is from the Clinical Pearls and IDD Healthcare book. Clinical Pearl number 21 is on aspiration. So what is aspiration? Aspiration is basically getting food or fluid or stomach contents or saliva or basically anything in the wrong place, meaning instead of it going down the esophagus into the stomach, it goes down your windpipe into your lungs. Now, we've all done this at some point. We've all had an experience of aspirating a little bit where we drink something and we start coughing immediately, or we get a little choked on something like that. That's the beginning of aspiration. That's actually the most common symptom. So anytime you see a person that you're supporting, that you're working with, who is drinking or eating or taking medications or swallowing anything, and they immediately start to cough, you should think about aspiration. Now, why should we think about this? Number one, it's not pleasant. It's really uncomfortable. But more importantly, there's an increased risk of getting aspiration pneumonia from this, which is a serious condition, again, which can lead to death. Some people with disabilities have positional difficulties that can make swallowing more difficult. And what I mean by that is, here's actually a great example. Turn your head to the side, take a cup of water, and try to swallow with your head turned to the side. And you're going to see that it's much harder to swallow than if you're aligned and your head is forward and your neck is down just a little bit. Or if your neck is tilted back and you try to swallow, you're going to have a harder time, and it's going to be much more easy to aspirate. Well, some people with disabilities, with cerebral palsy, have body shape differences that make it harder for them to swallow. So one of the things that we can do to help reduce this is to learn about proper positioning. One of the things we talk about is having your nose, your navel, and your knees all in alignment forward. That can help make swallowing easier. If you place the back of your hand on someone's neck, if your hand can't fit flat, then their head is probably tilted too far back, and that can increase the risk of aspiration. So these little bitty things like that are things that anyone can do that can help reduce the risk of something like aspiration. So it's very important to think about these things. Now, aspiration can come from swallowing something, so when things come in, but it also can come from the inside, meaning reflux, which is another one of these fatal 5+ conditions. We'll talk more about that one in a different episode. As well as just vomiting episodes. Okay, when we vomit, we might aspirate. And you remember when we talked about constipation as being the number one thing? I can't tell you the number of people that I've seen over the years that have been hospitalized with aspiration pneumonia, but the reason they aspirated is because they were so constipated that they began throwing up. And then they aspirated because they threw up. So when I talk about constipation being the number one cause of just about everything, and I say that a little tongue in cheek, but in a lot of ways it is true. Constipation was the reason that person ended up in the hospital with aspiration pneumonia. So think about aspiration. Be really aware if you see people coughing when they're eating or drinking or taking medicines, or even if they're coughing a lot after a meal, that could indicate reflux, and they may be aspirating as well. So think about those things. If you work in this field, make sure you let a nurse or some other medical person know that you're seeing these types of signs, so that that person can be evaluated and get treatment that they need. We'll see you again. We'll talk about another one of these in the next episode.